we must know what is Shodhana. You have already learned in the first classes, initial classes. We can go through this Shodhana. The process of the forceful expulsion of the dosha is known as Shodhana. That is, it is of 5 types: Niruha, Vamana, Virejana, Nasya, and Raktamoksha. Yadirayet Bahirdoshan, Panjatha, Shodhanam Chatat. You have learned that quotation. And the some synonyms of Shodhana are Shodhana, Apakarshana, Doshavasejana, Doshaharana, Kshetrigarana, Dosha Nirharana. Next slide, please. Next slide. Okay, this Shodhana is indicated in Bahu Doshavastha. You know that Tatra Alpe Lenghanam Pathyam Mathe Lenghana Pajanam Prabhude Tathi Shodhanam. So Shodhana is indicated in Bahu Doshavastha. And in Charaga Vimanasthana, a simile is there. That is, without breaking the boundary wall, it would not be possible to dry up a pond. Similarly, when the doshas are exceedingly vitiated, this Shodhana is the only way to expel them. Okay, then Shamana, Langhana, Pajana, these modalities do not have the capacity to subside the dosha. It is mentioned in Charaga Vimanasthana. Okay, next slide, please. And coming to the importance of Shodhana, this dosha pacified by Shodhana will not reoccur again. Okay, then Shodhana therapy acts on the root sites of the dosha and remove them from the body. So it is known as the radical treatment. In initial classes of Snehana, I have taught you that it is a radical treatment and it eliminates the dosha from the root itself. Okay, also Charagacharya mentioned a simile that if a plant is destroyed except root, it will grow again. Like that, Shodhana of mind and body and mind is a prerequisite for administration of Rasayana therapy. Before doing this Rasayana and Vajigarana, the Shodhana of body and mind is very important. Okay, next slide. Mainly, you know the difference between Shodhana and Panchakarma. No? This Shodhana means it is of 5 types. Panchakarma is also of 5 types. Shodhana includes Vamana, Virejana, Basti, Nasya, Raktamokshana. Panchakarma, what are the Panchakarmas? Vamana, Virejana, Anuvasanavasti, Niruhavasti, Shirovirejana or Nasya. And this Shodhana is included under the Lenghana Chikilsa, and Panchakarma, it acts as both Lenghana and Brahmana. This Anuvasanavasti, we can't include it under Lenghana, it comes under Brahmana. Also this Nasya, Niruha, Vasti and all have Brahmana actions also. Brahmana Nasya is also mentioned there. Next slide, please. What is the utility of Shodhana? You know, nowadays, due to this irregular lifestyles, so many disorders are coming. Mainly, this Mandakni is the root cause of many diseases. So, to rule out this Mandakni, our Shodhana is very important. And by doing this Panchakarma or Pancha Shodhanas, what are the utilities? Buddhi prasadam, belam indriyanam, dhadu sthiratvam, jwalanasya deeptim, chiracha pagam, vayasa karodi, samshodhanam, samyak upasyamanam. This is the quotation from Ashtanga Hridayam Sutrasthanam. Buddhi prasadam means clarity of mind, then strength of the sense organs. Indriyas become more strengthened. Then dhadu sthiratvam, tissues become more stable. Jwalanasya deeptim means digestive power will be increased more. Chiracha pagam vayasa karodi, slow aging occur from purification therapies if properly done. That is samshodhanam samyak upasyamanam. If this shodhana procedures are properly undertaken, these are the utilities or these are the benefits. Okay, next slide please. This quotation you can by heart it. And what are the fundamental principles of this Shodhana treatment? Yatha asanna doshaharanam, yatha doshaharanam, yatha bala shodhana, yatha kala doshaharanam. Okay, these are the main points. I will go into the details. Next slide, please. Yathasanna doshaharana means after sneha sweda, when dosha come to this koshta, they should be expelled from the nearest root. Through Purva Karma, we are making this dosha to come to the koshta, and or either by Vamana or Virejana or Nasya, we are doing the expulsion of the doshas. Looking into the site of dosha, if Amasha is the site of dosha, and the dosha predominance are the Kapha and Pitta, nearest root is Mukha, and the therapy apt is Vamana. Then coming to Atho Amashaya, that Pitta is the main dosha, Guda is the nearest root, and we will do Virejana. And Pakvashaya, Vada dosha is the predominant. Then nearest root is Guda. Therapy included is Vasti. If the site of dosha is Shira, Kapha is the dosha, Nasa is the nearest root, and Nasya will be done. This is the Yathasanna doshaharanam. Next is Yatha doshaharanam. You know that in this Kapha dosha, Vamana is indicated, in Pitta dosha, Virejana is indicated, and Vada dosha, Vasti is the main treatment. Next slide, please. Yatha Bela Shodhana. According to the Bela of the patient, this Shodhana depends. Bela of the patient and Bela of the dosha. If dosha Bela is Alpa and Rogi Bela is also Alpa, Mrudu Shodhana is indicated. And likewise, in Madhyama type of Shodhana, and in superior type of Bela is there for dosha and Rogi, we prefer for this Uttama Shodhana. Next slide, please. Next is the Yatha Kala Doshaharanam. Kala means it determines the desired effect of the administered drug. The suitable time for Shodhana therapy in healthy person for prevention of Roga is, Vasanta Kala for Kapha dosha, Varsha Kala for Vada dosha, and Sharat Kala for Pitta dosha. These are the fundamental principles of the Shodhana. We have go through this. Yatha Sanna doshaharanam, Yatha doshaharanam, Yatha Bela Shodhana, Yatha Kala doshaharanam. Okay, these are the main principles of Shodhana, and now we can enter directly to this Vamana procedure. Next slide, please. Coming to this Nirukti, Vam Udgare Ekset. This is the Nirukti. Some terms are there: Mardane, Chardane, Nissarane, Swargabhishyanda. These are the Nirukti. Mardane means destroying, crushing, grinding. Chardane, it is derived from the root word chard. Nissarane exhibits the expressions like running away from, flowing out, expelling. Then Swargabhishyanda, that is the prefix Swarga is appended to this word Abhishyanda, meaning gadi or oozing out with force. Okay, these are the Nirukti of Vamana. Also, in next slide, please. Vaidyaka Kalpa Sindhu, it is mentioned that Urtha Mukha Dosha Harana. And in Amara Kosha, Vama means Udgirana. Okay, these are the Niruktis. Mardane, Chardane, Nissarane, Swargabhishyanda. And then this Urtha Mukha Dosha Harana is mentioned by Vaidyaka Kalpa Sindhu. In Amara Kosha, Vama means Udgirana. And some synonyms of Vamana are Chardi, Chardana, Vami, Ullekhana, Lekhana, Virejana, Virega, Samshodhana. Okay, you will be aware of this terms Ullekhana. In Sneha Vyapat, we have learned that the treatment for Sneha Vyapat, Ullekhana, Takrarishta Khala Uddala, in that Ullekhana is mentioned. Okay. And Virejana also, this both Virejana and Vamana is mentioned as Virejana term. Okay, then Samshodhana also, it includes Vamana, Virejana, etc. But the synonyms of Vamana includes this Samshodhana. And coming to the definition, Tatra dosha haranam urtha bhagam Vamana sapnyagam. In Charaga Kalpasthana, this definition of Vamana and Virejana is mentioned. In that context, this Virejana term can be adopted to both Vamana and Virejana. It is Tatra dosha haranam urtha bhagam Vamana sapnyagam. Then Urtha Bhaga should be considered as Urtha Mukha. It is mentioned by Chakrapani. Urtha Bhaga means Urtha Mukha, through which Vamana is practiced. And then in this dosha haranam means bahulyena kapha pitta nirharanam. Dosha haranam in vamana bahulyena kapha pitta nirharanam is done, and this dosha harana is mentioned as this kapha pitta nirharanam. And general meaning of this vamana means, you know, that it is therapeutically induced vomiting of the stomach contents. And here, what all contents are expelled? Kapha, kapha's conjunction with one dosha, that is samsargaja dosha, or both other doshas, sannipadaja dosha and mala, which are toxic to the body, are eliminated through the urdhva mukha or mouth. That is the definition of vamana. Next is the quotation. Apakwa pitta sleshmanau baladurtham nayettu yat vamanam tadhi vijneyam madanasya phalam yatha. This quotation is mentioned by Sharngadaracharya. That is, apakwa pitta and kapha is eliminated through this vamana karma. Okay, apakwa pitta means vidakta pitta. Bakwa pitta and kapha is expelled through this vamana. Balad urtham nayetuya, through mouth. This apakwa pitta and kapha is eliminated. Vamanam tadhi vijneyam madanasya phalam yadha. That is, the drug by which vamana is done is, main drug is the madanasya phalam. Madana phalam is the main drug indicated in vamana. And this apakwa literally means it is undigested or unripe. Apakwa. And you have learned in this Matra Shidiya Adhyaya, Ashtanga Hridaya, and Vishtap. Types of ajirna are mentioned. Amajirna, Vidakta jirna, Vishtapta jirna. And in that context, the treatment mentioned is, for Amajirna Langhana is mentioned, Vidakta jirna Vamana is mentioned, Vishtapta jirna Swedana is mentioned. So this apakwa pitta means vidakta pitta, and indirectly or directly we can go to this vamana treatment. Okay. And coming to the types, based on the potency of the medicine, mrudu, madhyama, tikshna are mentioned. This in Charagam Kalpa last chapter, you can go through this different types of recipes according to the potency. Okay, that is, mrudu is used when the rogi bala is less, and tikshna is used when the rogi bala is comparatively more, and madhyama, it becomes in the middle of that. And also sadhyo vamana is a type in which mrudu shodhana is done. We will give sadhya snehana to the patient, and directly we go for the sadhyo vamana. Also, in diseased state and in healthy state, in your syllabus point itself it is there, this utility of vamana in health and disease. Likewise, that in diseased state we can do vamana, also in healthy state we can do vamana. Next, coming to the placement of vamana karma, where we can place this vamana. In panchakarma, before performing any other karma, vamana karma has to be done first. Why it is mentioned like that? The reason mentioned by Sushruta is that before we do virejana, vamana should be done, or before we do any panchakarma, vamana should be done. If not, kapha will move towards grahani and cover it, leading to mandakni, gaurava and pravahiga. This is the reason why vamana is kept in the first position. Okay, if kapha will move towards the grahani and cover it, leading to mandakni, gaurava, pravahiga. This is mentioned by Sushrudacharya. Next, coming to the criteria for vamana. What are the criteria for vamana? One is the upasthita dosha, and second is the bahudosha avastha. Okay, upasthita dosha, you are hearing this term from the initial classes itself. No, upasthita means what? Shakham tyaktva koshtaagamanena. Okay. How to make upasthita? It naturally happens during this Ridu Avastha. Naturally occurs in this Vasanta Kala. In Adura Avastha, Bala, and Vyadhi Avastha, in Navajara, it makes the normally or naturally it becomes Upasthita. Also, we have learned that with the help of Purva Karma, we make the doshas become Upasthita. Next, coming to the importance of Vamana Karma. Okay, it is the best line of treatment for Kaphaja disorders and not limited to only Kaphaja disorders, but also it helps in the cure of Pittaja diseases. We have learned that Apakwa Pitta Sleshmano Veladurtham Nayetuyat. Also, this Apakwa Pitta can be eliminated, not only this Kaphaja disorders. And this expels the Apakwa dosha from the body. Also, Acharya Sushruta states that when the root of the tree is cut, the flower, fruits, and branches are destroyed. In the same way, diseases originated due to excessive kapha are pacified after the elimination of kapha by vamana. Okay, if the root of the tree is cut, what will be these flowers and fruits become? It will be destroyed. In the same way, if the diseases are originated due to this excessive kapha, and by this vamana, that elimination of kapha occurs and that diseases will be eliminated or pacified. Also, the diseases like Kasa, Ubaleba, Swarabheda, Tandra, Mukhadaurgandhya, Kapaprasega, and diseases produced because of toxins and the diseases produced in Grahani will not occur after Vamana Karma. Okay, this quotation you cannot by heart it, but this matter you can learn and write in the exam. Okay, diseases like Kasa, Ubaleba, Swarabheda, every diseases are mainly the kapha predominant diseases. Okay, kapha prasega, mukha daurgandhya. This cannot be or will not occur after this vamana karma. Also, this kapha disorders and associated pitta disorders or diseases originating or settled in the place of kapha, that is in the kapha sthana, will be relieved either permanently or for a longer period of time by this vamana. Also, it helps to prevent the forthcoming diseases due to this kapha and pitta. Most of the Ayurvedic drugs we are administering through this oral route. Okay. And this first, it goes to the Amashaya, which is the main seat of kapha. And then what happens? Digestion of food also starts from the Amashaya. And if there is accumulation or aggravation of kapha in Amashaya, what happens? The digestion of food or drug cannot take place properly. With the help of this Vamana Karma, Amashaya Shuddhi occurs. So the digestion of drug and food takes place properly. Okay, next slide please. That is, this digestion of food occurs, starts from the Amashaya, and this aggravation of kapha will, if there is accumulation of kapha in Amashaya, digestion of food or drug, not only food but drug cannot take place, and with the help of Vamana Karma, Amashaya Shuddhi occurs, and thereby the digestion of drug and food occurs properly. Next slide. These are all of Koshta and Agni in Vamana. Okay, by Aruna Datta it is mentioned that Sleshma Tikkena Mridutvam, Sleshma Matyatvena Mathyatvam, Sleshma Heenatvena Kruratvam. That is, Mridu Koshta means Bahu Kapha. This opinion is mentioned by Aruna Datta. In Bahu Kapha Avastha, that is Mridu, Alpa Matra is mentioned, and Mathyama Koshta, that is Mathyama Kapha is there, and Mathyama Matra is mentioned. In Krura Koshta, Alpa Kapha is there, and Uttama Matra is mentioned by Arunadatta. Sleshma Thikkena Mridutvam, Sleshma Matyatvena Mathyatvam, Sleshma Heenatvena Kruratvam. Next is Agni, role of Agni in Vamana. That is, Vamana can be administered only to a person having Tikshna Agni. In Sushrutam Chigilsa, it is mentioned that Atha Aduram Snigtham Swinnam Abhishyandibhiraharir Anavabattha Dosham Avalokya Shvo Vamanam Payayitva Asti Iti Sambhojayet Tikshnaagnim. Okay, it can be administered only to a person having Tikshnaagni. Tikshnaagni means it should have the Samyak Agni Deepti. Next context is Sadhyo Vamana and Agni Deepti. The context of Sadhyo Vamana is mentioned in Jwara Chigilsa, Tatra Utklishte, Samutklishte, Kapapraye, Chale Male. Also, that after Vamana Karma, Vishoshana Kriya, that is Upavasa, has to be performed. Kride Akride Va Vamane Jwari Kuryat Vishoshanam. Through this Vishoshana Kriya, what will be the effect? Doshanam Samudirnanam Pajanaya Shamanaya Cha. These are the main role of Agni in Vamana. And where this Vamana is to be advised, that is, next is the indications of Vamana, where it is advised. In Bahudoshavastha, initially we have seen that in Bahudoshavastha, that is, when doshas are accumulated in large quantity, then Kapha Pradhana Vyadhi, in Amashaya Sthita Vyadhi, that is Kaphasthana Vyadhi. More specifically speaking, aggravation of kapha in its own sites, then kapha combined with pitta, which is present in a small proportion, vada or pitta invading the sites of kapha, excessive increase in the levels of kapha. These are the specific indications of vamana. Also, next slide please. It can be categorized according to two types. One is dosha dominance in disease. Second is the site in which provocation of dosha is taking place. This opinion is mentioned as per Hindu. That is categorized according to dosha dominance in disease and site in which provocation of dosha is taking place. And disease expecting shodhana, diseases having bahudoshavastha, diseases requiring vamana due to marga virodhatva, diseases having kapha dominance. Likewise, we can classify this or categorize this. Diseases expecting shodhana means in unmada, apasmara, vittha, vishapida, etc. This shodhana, uttama shodhana is indicated. Uttama matra shodhana is indicated in these types of diseases. Then diseases having bahudoshavastha like kushta, prameha. Then diseases requiring vamana due to marga virodhitva. You know that in Adhoga Rektapitta, you will learn in this Kaya Chikitsa, in Adhoga Rektapitta, the treatment is vamana. Then diseases having kapha dominance, that is Shwasa, Kasa, Ajirna, Agni Madhya, Peenasa, Sleepada. That is all, they are all kapha predominant diseases, and vamana is the main treatment. Next slide, please. Next is the Vamana Yogya or indication. This quotation you must study it. You must by heart it. Visheshena tu Vamayet Navajvara Adisara Atha Pittasrak Raja Yakshmina Kushta Meha Apaji Grandi Sleepada Unmada Kasina Shwasa Hrillasa Visarpa Stanya Dosha Urtha Rogina. Once more I will tell. Visheshena tu Vamayet Navajvara Adisara Atha Pittasrak Raja Yakshmina Kushta Meha Apaji Grandi Sleepada Unmada Kasina Shwasa Hrillasa Visarpa Stanya Dosha Urtha Rogina. That is, Vamana is more effective in Abhyantara and Bahya Roga Marga. By this, going through these indications, you can look that it is more effective in both Abhyantara and Bahya Roga Marga. And it proves to be beneficial in the diseases having kapha dominance. Also, it acts on Rasavaha Srodhas, Annavaha Srodhas, Pranavaha Srodhas, Medovaha Srodhas, and Mamsavaha Srodhas. Rasavaha, Annavaha, Pranavaha, Medovaha, and Mamsavaha Srodhas. This Vamana acts primarily on these Srodhases. Next slide, please. Practically, we are using this Vamana Karma in mainly the skin diseases like psoriasis, urticaria, eczema, allergy, acne, then bronchial asthma, depression, anxiety, neurosis, hypothyroidism. These are the practical indications of Vamana Karma. Next is the Vamana Ayogya or the contraindications of Vamana. Avamya Garbhini Ruksha Kshudido Nitya Dukkida Bala Vrittha Krisha Stula Hridrogi Shata Durbala Prasakta Vamatu Pliha Timira Krimi Koshtina Urtha Pravarta Vayu Asra Datta Vasti Hataswara Mutra Khadi Udari Gulmi Durvamo Atyakni Rarshasaha Udavarta Brahma Ashtila Parsharuk Vada Rogina Ride Vishagara Ajirna Virutta Apyavaharada. It is mentioned by Ashtanga Hridayam Sutrasthanam. Okay, 18th chapter. You must by heart this quotation. You can make a code and or by making the first letters like that. Okay, you must study. It is compulsory. It is very important, and it will be coming in exams and all. This contraindication of vamana with reasons. Okay, previously asked question is there. This vamana ayogya. अवाम्य गर्भिणी रूक्षा क्षुधितो नित्य दुःखित बाल वृद्ध कृशस्थूल हृद्रोगी क्षत दुर्बल प्रसक्त वमधु प्लीहा तिमिर कृमिकोष्टिन ऊर्ध्व प्रवृत्त वायु अस्र दत्तवस्ति हतस्वर मूत्राखादि उदरी गुल्मी दुर्वमो अत्यग्निरर्शसः उदावर्त भ्रम अष्टील पार्श्वरुक् वातरोगिण हृदे विषगर अजीर्ण विरुद्ध अप्यवहारत. Next slide, please. That is, by nature itself, this pregnant women, Sukumara persons, Ruksha Purushas, Kshutida, Shokarta, Krisha, Bala, Vritta, Durbala, these criteria are contraindicated by nature itself. Some disease conditions are in Vada Prakopa, that is Udavarta, Gulma, Vada Vyadhi. Also in Marmaja Vyadhi, like Hridroga, Mutrakhada, Timira, and Maharoga like Arsha, Udara, etc. This vamana is contraindicated. Next slide, please. There are some conditions where this vamana is not to give. Where not to give, that is diseases with acute onset, that is Hridgraha, Udavarta, diseases in which body is largely emaciated in Kshatakshina, example. Diseases in which dosha move in upward direction, that is Urdhvaga Raktapitta. Very weak aged individuals, diseases involving vital organs. Okay, you can categorize this contraindications like this: diseases with acute onset, diseases in which body is largely emaciated, diseases in which dosha move in upward direction, very weak aged individuals, diseases involving vital organs. Next is the reasons behind contraindications. It is very, very important. Okay. First, I will tell this avamya conditions and the reasons for contraindication. Okay, just imagine if this type of persons do vamana, these and these reasons are the mentioned for this contraindication. For example, first one, it is kshatakshina. That is a person who have got this chest injury. Imagine if a person with chest injury do this vamana, what happens? They may occur profuse hemorrhage due to this further strain and injury during and after vamana. Okay, in Kshatakshina, already they have chest injury. By straining, further straining and injury during and also after vamana, what happens? Profuse hemorrhage occurs. Next is the cachexic, that is fatigue persons, excessive obese, too young, too old, too weak or emaciated persons. What if they do vamana? There will be danger to the life because they can't tolerate this vamana karma or vamana aushadha bala, and it may leads to this death. Next is fatigued, thirsty and hungry. Also, the persons exhausted by constant labor, load lifting and walking, weakened by constant fasting, sexual indulgence, study, exercise and thinking. Look, these are the conditions where Vata dosha is more increased or more provoked. Due to that, what occurs? Due to this Rukshata, there will be Vada Prakopa and again leads to this hemorrhage or ulceration. Next is if Garbhini does this vamana. If Garbhini do the vamana, what occurs? Complications of pregnancy, abortion of immature fetus, and occurrence of severe diseases. Okay. Doctor, next slide, please. First is a Garbhini, that is complication of pregnancy, abortion of immature fetus, and occurrence of severe disease occurs. Next is delicate persons, Sugumara persons. What happens if they do vamana? Due to strain on stomach, severe hemorrhage takes place through upper and lower root. In Kshatakshina also we have noted that profuse hemorrhage occurs to that persons due to this continuous strain. Similarly, in Sukumara persons also, due to strain on stomach, What happens? Both through this upper and lower root, severe hemorrhage occurs. Next is the Samvrddha Koshta. Samvrddha Koshta means the persons whose alimentary tract is condensed or narrowed. And Duchardana. Two persons are there. That one is the persons whose alimentary tract is condensed, that is Samvrddha Koshta, and Duchardana means who do not easily react to emetics. What happens if they do Vamana? Morbid humors get stimulated but not eliminated, and it accumulates in the alimentary tract and causes internally acute spreading infection, stasis, dullness, or even death occurs. Okay, this as they have Samvrddha Koshta or narrowed Koshta, this humors or this doshas will not eliminate, and it accumulate in the alimentary tract and make many diseases or infectious diseases, and finally it may lead to death. Next is the Urdhvaga Rakta Pitta and persons afflicted with incessant vomiting. Prasakta Chardi. Urdhvaga Rakta Pitta and Prasakta Chardi persons, if they do Vamana, what happens? It may provoke Udana Vayu and take away the life or cause profuse bleeding. In Urdhvaga Rakta Pitta and Prasakta Chardi provoke the Udana Vayu and death may occur or cause a profuse bleeding. Next slide, please. Also, in persons who have taken Niruha, Anuvasanavasti, and who are having Urthavada, that is, Urthavada means Vada moving in upward direction. What will be the reason for this contraindication? Increase in upward movement of Vada. After Niruha, Anuvasana, and Urthavada, this Vada dosha will be moving in upward direction. And if we do again Vamana Karma, again there will be increase in the upward movement of Vada. Next is Hridrogi. Hridrogi doing Vamana will be occurring this further impairment in cardiac function. Next is Udavarta or reverse peristalsis. Aggravation of condition which may quickly cause death. Next is Mutra Khada. It causes severe acute pain if we do Vamana to that person. Next, suffering from Timira and Akshishula, further aggravation of that disease occurs. In Shankaga, you can imagine a person with Shankaga, if we do Vamana, what happens? The increase of pain will be more severe. These are the contraindications, reasons behind contraindications. Okay, just imagine what will happen to them if they do Vamana. Then it will be more easier to connect it. Okay, this is very important. In Siddhisthana second chapter, you can go through this quotation. तत्र क्षदस्य भूयक्षणनात् रक्त आदि प्रवृत्ति स्यात् क्षीण आदि स्थूल, like that it is mentioned. It is a big quotation. Better you study like this table and it will be more easier. Very important portion. Next slide. Even though some diseases are contraindicated, some acharyas have mentioned to do Vamana. Some examples are in Udara, though it is contraindicated, Gangadhara advised to do Vamana in Kaphaja type. Also, Harita have advised to do the Vamana in Jalodhara. Okay. Next is Gulma. In Kaphaja Gulma, Vamana can be done. And in Hridroga, Vada, Pitta and Kaphaja types of Hridroga, Vamana is mentioned as a treatment. In Vada Vyadhi, some of Vada Vyadhis in Gridrasi, Vaksha Gadavada, Triga Gadavada, Skanda Gadavada, Manya Gadavada, that is mentioned by Vangasena. In Pratyagmana also, Vamana is a treatment by mentioned by Sushrudacharya. Okay, these are the conditions or diseases. Even though contraindicated by many acharyas. Some acharyas have indicated in some conditions, in certain dosha conditions. Okay, next slide please. Okay, Vamanopaga Dravya means Vamanopaga Dravya. This is very important. Two types of drugs are coming under this Vamanopaga Dravya. Vamaga Dravya and Vamanopaga Dravya. What is a Vamaga Dravya? It is a drug which induces vomiting and has Urtha Bhaga Prabhava. One induces vomiting and have Urtha Bhaga Prabhava. What is Vamanopaga Dravya? One which supports the action of Vamaga Dravya. In previous class, we have learned that Snehopaga, Svedopaga, Upaga means which support or which promotes the action of so and so procedure. In this, Vamanopaga Dravya means one which supports the action of Vamaga Dravya. Example is Madhu, Lavana, etc. Some of these increases the effect and others prevent any kind of side effects. These are the quality of these drugs. Some drugs increase the effect of that procedure and some others prevent any kind of side effects or complications of that procedures. Vamanopaga Dravya. What are the Vamanopaga Dravyas mentioned by Charagam Sutram? They are Madhu, Madhuga, Kovidara, Karbudara, Nipa, Vidula, Bimbi, Shana Pushpi, Sada Pushpi, Pratyak Pushpi, Idi Deshemani, Vamanopagani Bhavanti. In Deshemani, this Vamanopaga drugs are mentioned like this. And some properties are mentioned. Next slide, please. This Vamanopaga Dravya Madhu, the properties are Kashaya Mathura Rasa, Guru Shita Ruksha Guna, Shita Virya, and Madhuga, it is Glycyrrhiza glabra, you know. Mathura Rasa, Guru Sniktha Guna, Shita Virya, Mathura Vipaga. Like that, I'm not going to these details. Nipa, Vidula, this botanical name is there, and Rasa Virya, Rasa Guna Virya Vipaga. You can go through it. It's not that much important. Next is Vamaga Dravya. Vamaga Dravya, we have learned that the drug which induces vomiting is the Vamaga Dravya. Those drugs which expels morbid doshas from upper channels. That means they are having the prabhava of Urtha Bhaga Prabhava. Bhala Jeemudaka Ikshwagu Kalpo Dhamargavasyacha Panjamo Valsagasya Ukta Shashtascha Kridavedane. In Charagam Sutra, it is mentioned that Vamaga Dravyas are Phala Jeemudaka Ikshwagu Dhamargava Valsaga Kridavedana. These are the 6 kalpas mentioned in Charagam Kalpasthanam. Madana Phala. Madana Phala, this botanical name is Randia dimatorum. Number of yogas mentioned is 133. Jeemudaka, Luffa equinata, 39 yogas are mentioned. Ikshwagu, Laginaria vulgaris, 45 yogas are mentioned. Dhamargava, Luffa cylindrica, 60 number of yogas are mentioned. Valsaga, Olarania antidysindrica, 18 number of yogas mentioned. Kridavedana, Luffa acutangula, number of yogas mentioned are 60. Total 355 Vamana yogas are mentioned. Okay, this you must learn this table, number of yogas and all. Next, coming to this Madana Phala. It is very important and it is the main, most commonly used drug in Vamana Karma. The synonyms are Karahada, Shalyaka, Chardana, Pindidaka, Radha, Vishapushpaga. And Sanskrit name is Madana Phala. Botanical name is Randia dimatorum. Rasa, Madhura Tikta, Lekhu Ruksha Guna, Ushna Virya, Kadu Vipaga, Kapavada Haranam. That is karma mentioned is Kapavada Hara, Chardana, Lekhana. Why it is Shrestha, this Madana Phala? Vamana Dravyanam Madana Phalani Shreshtatamani Ajakshade Anapayitvat. Anapayitva. This is the reason why it is Shrestha. It can be given in all the disease conditions because it does not oppose or aggravate any condition and helps in purification of all the doshas. Anapayitvat. That is the main reason. Does not cause any complications. How if used properly and it has no side effects. Okay. Okay, this Madana Phala can be given in all the disease conditions. Coming to this collection and storage. Okay, by seeing this quotation, you will be more afraid how to learn this sloka, but you can classify or categorize into this collecting time period, quality of fruits to be collected, processing, like that you can divide it and learn the quotation. This is very very important. The collecting time period mentioned is Tani Vasanta Grishmayor Andare Pushya Ashwayupyam Mrigashirasava Grikhniyat Maitre Muhurte. Okay, then quality of fruits to be collected. How the fruits should be? Yani Pakwan Yakan Aganan Yaka Ahiridani Panduni Akramini Aputinya Ajandu Jaktani Akraswani. Then processing. How it should be processed? Tani Pramrajya Kushapude Batva Gomena Alipya Yava Tusha Masha Shali Kulatta Mudga Palalanam Anyatamena Nidathyat Ashtaratram. I will go to this detail. Just I am reading this quotation. Okay. अद ऊर्ध्वं मृदुभूतानि मधु इष्टगन्धानि उद्धृत्य शोषयेत् सुशुष्काणां फलपिप्पलीरुद्धरेत् तासां हृद दधि मधु फलल विमृदितानां पुनः शुष्काणां नवं कलशं सुप्रमृष्टवालुगम् अरजस्कम् आकण्ठं पूरयित्वा स्ववच्छन्नं स्व अनुगुप्त शिक्केषु आसज्य सम्यक् स्थापयेत्. It is mentioned in Charaka Kalpasthanam. That is, next slide please. It should be collected during the period of transition between spring and summer in Pushya, Ashwini or Mrigashiras constellation and in Maitra Muhurta. Okay, that is the Tani Vasanta Grishmayor Andare Pushya Ashwayupyam Mrigashirasava Grikhniyat Maitre Muhurte. Then quality of fruits. How should be the fruits? Those which are ripe, undamaged, non-green, of pale color, free from organism, under compost, uneaten by animals, not too small, that is immature, should be taken. Pakvam, that is ripe, undamaged, akani, aharidani, that is non-green, not green in color, of pale color, panduni. Aharidani panduni means it should not be green in color, it should be pale in color. Free from organism means akrimini. Apudini means under compost. Uneaten by animals. Ajandu jaktani and ahraswani. Okay, this should be taken. Next, the processing. Coming to this processing, washed, it should be washed, wrapped with kusha grass. Tani pramrajya means washed. Kusha pude batwa, wrapped within the kusha grass and pasted with fresh cow dung. Gomayena alipya. Yava tusha masha shali kulatha. Any of this, you should be they should be stored for 8 days in this heap of any one of this Yava, Tusha, Masha, Shali, Kulatha, Mudga, Palala, etc. for 8 nights. Okay, that first we have collected the drugs, and then what the quality of fruits you have noted, that is ripe, undamaged, non-green, etc. And they should be washed, wrapped with kusha grass and pasted with fresh cow dung, and it should be stored in this heap of any this Eva, Tusha, Masha, etc. Any one of these for 8 days, and then thereafter when they get softened, what should be and develop honey, good honey like aroma will be developed, and at that time they should be taken out and dried. Ada urtham mridu pudani, that means it becomes softened, and madhu ishtagandha means it developed good honey like aroma. At that time udhritya shoshayet, at that time we must take it out and it should be dried in the sun. Shoshayet. Ada urtham mridu budani means it becomes softened. Madhu ishtagandha means honey like aroma. It will be having honey like aroma, and At that time, we must take it, udritya shoshayit, and dried in sun. And when they are well dried, their pepper-like seeds, that is, phala pippali uttaret, shushushkanam phala pippari uttaret, means that pepper-like seed should be mixed gently with ghee, curd, honey, and sesame paste, and again dried. That is the next slow quotation. Tasam krida dadi madhu palala vimrudidanam. They should be gently mixed in what? Krida, dadi, madhu, palala, and then again dried. Punaha shushkana. Finally, they should be filled up in a new earthen pot, well cleaned and dustless up to neck, and placed well on a swing of rope, well covered and well protected. These are the collection of Madanaphala. Next slide, please. These are the pictures of this Madanaphala collection. They are collected. Yeah, that kusha grass, you can see. Gomena alipya. Next slide, please. Yava tusha masha. Any one of this you can store it in 8 days. Then it will become softened. In that last picture, you can see it becomes softened, and honey like aroma will be there. Next slide. Then you can take it out, and what you should do? Tasam krida dadi madhu palala vimruditanam. Again, you should mix it with that. Next slide. That is the sesame paste. Next slide, please. These are the different methods you can see. Next slide, please. In the last picture, you can see that phala pippali is taken. These are the collection, preservation of Madanaphala. Okay. Next slide. Next is the Nimba. The properties are Tikta Kashaya Rasa, Laku Ruksha Guna, Shita Virya, Kadu Vipaga, and karma is Kapha Pitta Hara, Deepana, Grahi, Krimikna, and Netriya. About Nimba. Nimba also we are using for this Vamana. It is made this Nimba Kashaya and all for doing Vamana. Next is Kutaja. Tikta Kashaya Rasa, Shita Virya. In Raja Nikhandu, it is mentioned as Ushna Virya, and Lekhu Ruksha Guna, and Kadu Vipaga. Next slide. Yeshti Madhu. Madhura Rasa, Shita Virya, Guru Sniktha Guna, and Madhura Vipaga. That karma is Tridosha Hara, Rasayana, Vrishya, and Chakshushya. Next is Vaja. The properties are Kadu Tikta Rasa, Lekhu Tikshna Guna, Ushna Virya, Kadu Vipaga, and karma, it is Kapha Vadahara, Lekhaniya, and Medhya. Okay, these are the drugs mentioned in your syllabus, but the main important drug is Madanaphala. So I have detailed it, and you must go through this this Charagam Kalpasthana. Okay, if you have any doubt, I will clear it. You must learn that Madana Kalpa very well. Okay. Next is the Purva Karma of Vamana. What are the Purva Karma of Vamana? Some headings are there. Sambhara Sangraha, that is collection of equipments and medicines. Then Adura Pariksha, means examination of the patient or subject. Aushadha Matra Nirnaya, determination of the dose of medicine. Then Adura Siddhada, preparation of the subject. In that, it comes the Deepana Pajana, Snehana Svedana, Vamana Purva Bhojana Vyavastha, Manasa Upachara. These are the headings coming under the Purva Karma of Vamana. Sambhara Sangraha, Adura Pariksha, Aushadha Matra Nirnaya, Adura Siddhada. Okay. Coming to Sambhara Sangraha, from the preparation of Vamanagara to collection of drugs and food articles. It is coming under this Sambhara Sangraha. Vamanagara to collection of drugs and food articles. What is the aim of this Sambhara Sangraha? To carry out Vamana with ease. Easily we must do this Vamana. Or to achieve Samyak Yoga Pradibhogartham. To avoid complications and to counteract the complications occurring during the procedure. That is Vyapatsu. Vyapatsu means to avoid complications. Vyapat Pradigarartham means to counteract the complications occurring during the procedure. Next is Vamanagara. How should be the Vamanagara or emesis theatre? Some qualities are mentioned. Okay. Next slide, please. Dridam, that is, the theatre should be built strong. Nivadam, Pravadam, Egadesham should not be affected with direct wind. So the outlet of air should be only through one way. Then Pravadam, Egadesham. Sukha Pravicharam should be spacious to carry out the therapy comfortably. Then Anupatyagam should be away from high mountains and other buildings. To it should be placed in a comfortable area devoid of any disturbances. Dridam, Nivadam, Pravadam, Egadesham, Sukha Pravicharam, Anupatyagam. Then Dhuma Adaba Jala Rajasam Anabhigamaniyam means it should be protected from external fumes, light, water, and dust. Next slide, please. Dhuma Adaba Jala Rajasam Anabhigamaniyam. Then Udapana should have adequate water supply. In between this Vamana procedure, water is needed. The patient may want to go to toilet or anything like that. Adequate water supply is a must. It should be devoid of undesirable sound, touch, vision, taste, and smell. These are the qualities mentioned for this Vamanagara. Dridam, Nivadam, Pravadam, Egadesham, Sukha Pravicharam, Anupatyagam, Thuma Ataba, Jala Rajasam, Anabhigamaniyam, Udapana, and this should be devoid of undesirable Shabda, Sparsha, Rupa, Rasa, and Gandha. And next is the Parijaraga or assistants. 4 types of Parijaraga are needed in this Vamana Karma. Next slide, please. Samvahaga, Lalada Pradigraha, Parsha Pradigraha, Patra Pradigraha. If after we go to this Pradhana Karma, you will be more aware about this assistance or Parijaraga. Samvahaga means to supply the Aushadhi and other Dravya. One person should be there to give that Aushadhi or anything like that, this Vamanobhaga Dravya, anything like that. One Samvahaga or one assistant is needed for that. Next is to hold the forehead of the subject. In this Pradhana Karma, in this Vamana procedure, some persons or some assistant are needed to hold the forehead of the subject. Lela Ada Pradigraha. Next is to hold the body of the subject, Parsha Pradigraha. In both sides, assistant should be there. One to hold the lalada or forehead, another to hold the Parsha Pradesha. Then Patra Pradigraha, to hold the Vamana Patra. Okay, while doing this Vamana procedure, one should hold the Vamana Patra. Next is the Adura Pariksha. Adura Pariksha. First, initially what we should do means look whether the subject or patient is Vamya or Avamya, whether she or he is indicated for Vamana or contraindicated. Then normally Ashtasthana Pariksha, Dashavida Pariksha, it should be done. And it is an inseparable part of Adura Pariksha in every procedure. Next is examination of Dosha, Desha, Kala, Bala, Sharira, Ahara, Satmya, Sattva, Prakriti, Vaya, etc. Samiksha, Dosha, Aushada, Desha, Kala, Satmya, Agni, Sattva, Adi, Vayo, Balani. This must be in mind before every procedure. Next is Adura Siddhada, means the points coming under this are Niramikarana, that is Agni Deepana, and Snehana Svedana. In Snehana, it is Abhyandara Snehapana and Bahya Snehana is there, and Svedana is there. These are the Adura Siddhada. For making this Agni Deepana, we must do Deepana Bhajana. Next, Abhyandara Snehapana and Bahya Snehana is done. Also, Svedana is done. Next slide. To achieve Koshta Lakhuda and Agni Uttejana by administering Mrudu Bheshaja, we do this Niramikarana. That is, the Koshta Lakhuta must be there before doing this Vamana Karma. In initial classes, we have learned that Shodhana Karma done in the presence of Ama will result in destruction of the body. How? Similar to this, extraction of juice from an unripened fruit will result in its destruction. Like that, Shodhana Karma done in the presence of Ama will cause the destruction of body. Also, Shodhana administered in conditions of Ajirna will lead to Vibandha and Glani. On the contrary, it will give fruitful effect in the absence of Ama. Some medicines we are giving are Shunti Kashaya, Rasnadi Kashaya, Chitragadi Vadi, Trigadu Churna, Jiragadi Churna, etc. for this Deepana Pajana. Then next is the next slide. Snehana means it includes both Abhyandara and Bahya Snehana. Abhyandara Snehana we have studied in detail how we should do this Abhyandara Snehana. In Arohana Matra we can do, or in Sadhyo Vamana we can do as Sadhya Snehana. Then Bahya Snehana means external application of this oil or Sneha, where Sarvanga Abhyanga along with Sarvanga Sweda in whole body should be done following this Abhyandara Snehapana. After attainment of Samyak Snigdha Lakshanas, Abhyanga and Svedana should be advised for either once or twice on the rest day and just prior to this Pradhana Karma on the day of Vamana. That is, we are doing 7 days of this Snehapana, and we have got this Samyak Snigdha Lakshana. Abhyanga can be, Abhyanga and this whole body, Sarvanga Svedana can be done for either once or twice on the rest day, means next day. Next day we will be giving rest for the patient, and we will be giving this Kapha Utkleshagara Ahara. I will go to that in detail. Okay, this Snehana means Abhyandara and Bahya Snehana we will be doing, and next Sarvanga Abhyanga with Sarvanga Sweda it is included. And after Samyak Snigdha Lakshanas, Abhyanga and Svedana should be advised for either once or twice on the rest day and just prior to this Pradhana Karma. On that day of Vamana, before doing this Pradhana Karma or this Pradhana Vamana, we will do this Abhyanga and Nadi Sweda for that patient. Next is the diet. It can be in 3 headings. That is, Vamana Purva Bhojana Vyavastha can be dealt in 3 headings. Diet during the days of Snehapana, that you have already learned that. Diet for previous night of Vamana. Diet just preceding to Vamana Karma during the days of Snehapana, and for the previous night of Vamana and just preceding to this Vamana Karma. Diet, next slide. Diet during the days of Snehapana. Dravoshnam Anabhishyandi Nati Snigdham Asankara. You have learned that. Pojyo Annam Matraya Pasyan Shwaha Piban Pidavanabi. Dravoshnam Anabhishyandi Nati Snigdham Asankaram. That is, it should be Drava, Ushna, Pramana Yukta, Anabhishyandi diet. It should not cause more slimeness. Okay. It should be Anabhishyandi. The food must not have too unctuous material mixed in it. It should not contain the articles having the property to provoke other dosha, and patient should be advised to drink lukewarm water whenever needed. Okay, only lukewarm water is indicated. Next is the diet for previous night of Vamana. In previous night of Vamana, the individual should be instructed to take food which aggravates Kapha dosha. Why? Because we are doing this Vamana to eliminate this Kapha dosha. So for to aggravate this Kapha dosha more, we will indicate or instruct this patient to take more Kapha aggravating food such as milk, Krisara made up of rice, Masha Payasa can be given, Sesame can be given, Jaggery in enough quantity along with curd. Also in Charaka Siddhisthana, first chapter, it is mentioned that Gramya Audaga Anuparasei Sa Mamsei Utkleshaniya Sa Payasa Cha Vamya. That this Gramya Audaga Anuparasa can be given along with this Mamsa and Paya. Paya means milk for a person who is indicated to do this vamana. It is mentioned in Charagam Siddhisthanam first chapter. That is, person who is to be administered emesis or vamana should be given milk and the meat, as well as meat soup of domesticated, aquatic and wetland inhabiting animals as food for the excitation of kapha. That quotation you can learn. Gramya audaga anuparase samamse utkleshaniya payasacha vamya. Next is the food articles before vamana. By Arunadatta on Ashtanga Sutra, it is mentioned that in persons of less strength, old age, very young age, having fear for vamana, Vaidya can provide Yusha, Ikshurasa, milk, Mamsarasa, Madhya, Tushodaga, Yavagu, Manda, according to the condition. These are the food articles before, just before Vamana. For Agantapana, we will be giving Yusha, Ikshurasa, milk, Mamsarasa, Madhya, etc. according to this persons. How in less strength, old age, very young age, having fear for Vamana, we can adopt this, any one of these articles, food articles. To others, just before starting Vamana, Yavagu mixed with Grida can be given. However, excess quantity of Grida should not be given. Before starting that main Pradhana Karma, main Vamana, and that day, Yavagu mixed with Grida can be given. These are the diet. Diet during the days of Snehapana, diet for previous night of Vamana, diet just preceding to Vamana Karma. I think it is clear. Next is the Manasa Obajara. Manasa Obajara means Egagra Manasa Pidam Samyak Yogaya Kalpade. In Charaga Kalpasthana it is mentioned. It refers to the state of mind which is required to conduct proper emesis. To achieve this, the subject must be instructed about Vamana Karma prior the day of Vamana itself and advised to take head bath, anoint the body with perfumed oil and wear garlands of flowers having good smell and wear good clothes. Okay, before this Vamana Karma, before the day of Vamana, that patient must be instructed very well about the procedure, what we are going to do, what will be occurring in the body, like that. They must be instructed very well. Also, this next slide, Vasantika Vamana. In this utility of Vamana Karma in health and disease, you have noted in that syllabus point. Utility of Vamana in disease condition, you can write this indications and all very detailedly. In very detail, you can write the indications of this Vamana Karma under the utility of Vamana in disease condition. In health condition, that we are all doing this Vasantika Vamana. These are coming under the utility of Vamana Karma in health. In this syllabus point, you can just write down these points. Vamana procedure is indicated for the expulsion of Kapadosha. We have already learned that in fundamental principles of Shodhana, Yatha Dosha Harana. In that, Kapadosha is provoked in the Vasanta Kala. So we are doing this Vamana Karma in Vasanta Kala. And mainly it will be coming approximately in the month of March and April. Almost everybody can undergo Vasantika Vamana except those suffering from the diseases contraindicated for Vamana, like bleeding from the upper channels of mouth, upper GIT, bronchial tree, emaciated, very old, pregnant women, persons with hypertension and heart diseases, exclusively Vada Prakriti and Vada disorders. Except these persons, everybody can undergo this Vasantika Vamana. Next, I will summarize. These are the main points coming in this class today. That is part 1. I have dealt with this what etymology, definition of this Vamana, and indications, contraindications, and reason behind the contraindication. Also, this role of Koshta and Agni in Vamana Karma. Before that, I have gone through this Shodhana procedures. And then Vamana, Vamanopaga Dravya, its properties, actions, and mainly this Madana Phala collection, preservation, and Purva Karma of Vamana, which includes Deepana, Pajana, Abhyantara Snehana, diet, etc. And in the next class, I will be dealing